Hello and welcome to our podcast series on Spotlight on Community Engagement and Involvement. My name is Saumu Lwembe, Assistant Director for Patient, Public and Community Involvement and Engagement at the National Institute for Health and Care Research. I am joined by Professor Richard Lilford and his colleagues Jayashree Kunju from India and Amar Timalsina from Nepal. In today's episode, we will be exploring a rather elusive, challenging, intriguing, but very important concept on power sharing. We will use Professor Lilford's study on transforming the treatment and prevention of leprosy and Buruli ulcers in low and middle-income countries as an example of how power can be truly or effectively shared between researchers and community members. Before going any further, may I welcome our guests to introduce themselves. Starting with you, Professor Lilford. Kindly tell us, our listeners, about yourself and your involvement or interest in community engagement and involvement.
Well, thank you very much, Samu. Yes, I'm Professor Richard Lilford. I'm Professor of Public Health here at the University of Birmingham. Before I was involved in public health, I was a Professor of Gynecology and Obstetrics at the University of Leeds. So I gradually shifted over to public health. I did a lot of work in the delivery of services, both in this country and other countries abroad. I'm delighted to be the director of the RIGHT program on leprosy and Buruli ulcers, as you've heard. I'm joined here today by my colleague, Saumu Lwembe, who is the manager for this large project, nearly £5 million.
Thank you, Prof. Jayashree, may I welcome you, please, to introduce yourself to our listeners today.
Yeah, hi, everyone. I'm Jayashree Kunju from Bangalore, India, a chartered accountant by qualification, and someone with a personal experience of leprosy almost 4 decades ago when I got the disease and I got cured. And ever since then, I've been working actively for spreading, the information about leprosy, how it's a simple disease of no significance unless if it's treated on time. I'm so happy to be part of the research with Dr. Richard Lilford's team. So happy to be here.
Thank you so much, Jayashree. Amar, may I welcome you to introduce yourself to our listeners today.
Yeah, hi everyone. Thank you so much for this wonderful opportunity to introduce myself. My name is Amar Timalsina. I am from Nepal. Like Jayashree, I myself is a person who has personal experience of leprosy, or nowadays we call Hansen's disease. I work for IDEA International as the Global Network Coordinator. At the same time, I also support to IDEA Nepal in various ways. By profession, I am a teacher, and I founded a school of my own, which is in Kathmandu. And I'm so delighted to be part of this research group, joining with Dr. Richard. And I have been involved in many CEI meetings in Nepal, supporting to the community members and bringing their real voice, ground voice. And so this is really, I'm supporting in both ways. Thank you so much. And I'm so delighted to be part of this wonderful research team.
Thank you so much, Amar. Let's go and find out a bit more about your research. So Professor Lilford, tell us more about your research and particularly how community engagement and involvement, or in short, CEI, is embedded within it.
Well, thank you very much. So when we were preparing this grant, when we'd been shortlisted but not awarded the grant, we traveled out to Nepal. We were joined by colleagues from India and Nigeria. Those are the 3 countries participating in this application. And we've discovered when we got there that there was already an extremely well developed network of public representatives who were already advising leprosy care, treatment and management in all the countries. They worked closely with the leprosy missions, who were our partners in all those countries. There's a long tradition going back for nearly a century of involving people in the decisions about the care that they receive by the leprosy missions. And so when we found this, we realized we didn't need to recruit, looking for new public representatives. We already had a network which we could collaborate with. And so that's how we started to build our engagement. And indeed, this idea that representatives to advise on research should also be the representatives who are advising on the topics that are being researched and on the service delivery of those topics. It makes sense, as I'll say in my concluding remarks, it makes sense to involve them in the research as well. There are many advantages and no disadvantages to doing so. And so while we were out there, we were working on forming the shape, the contours of the grant that we were ultimately going to submit. And the public representatives were hugely instrumental and informative in doing that. It was because of them that we created the biggest emphasis, not on the treatment of ulcers, which we do, but also on the prevention of the sort of rotating door of ulcers clearing up, recurring, and the person having to be readmitted. And so much of our work, the bulk of our work, thanks to the input of our community and public representatives, is in the community. And it's been an absolutely fascinating journey. We've now got 5 or 6 projects running in the communities around the world, which were shaped by those early days. And our public representatives have been at the forefront of guiding us through the whole of this process. It has been an extremely rewarding and informative process of two-way exchange between the scientists, the local practitioners, and the public that we all serve. That's my introduction. Thank you very much.
No, thank you. That's really interesting, and something you said there around actually going and finding that this community of practice is already existing, and that's quite strong, isn't it? You know, the whole idea of not going to create new structures or reinventing the wheel, and therefore, you know, avoiding a lot of wastages, which at times that's what most researchers do when they're going into a new territory. So really taking that asset-based approach in recognizing what is already existent in the local community or geographical area that you're going to do that research. I think that is really powerful. What elements of the CEI are you most proud of? I mean, you've canvassed a lot, isn't it, around you know the infrastructure that was already existent and how you've actually taken those voices and informed the design of your research. But what elements of that work are you really proud of?
I think mostly the fact that we've now got such a strong community focus.
Mm-hmm.
And more than that, we are concentrating on much more than just the disease itself.
Mm-hmm.
People affected by leprosy are often among the poorest of the poor, and they can become further marginalized because of stigma that may exist in their communities. So, so we are doing interventions which don't just aim to improve ulcer care, but actually seek to improve social integration of people in their communities, and also to economically empower, because some people with leprosy, they're often farmers. When they get leprosy, they have to make a trade-off between continuing to earn a living and caring for their ulcers, where they need to avoid putting too much weight, particularly on their feet. So to look at economic empowerment as well. So we've ended up doing an intervention which takes care not just of the body, but of the psychology and the social situation. And we are evaluating these by as rigorous as we possibly can, trial methods. And we are also looking at the sustainability. So there are many experiments that have been done, funded by leprosy missions and governments around the world, to provide improved social integration and economic development for people affected by leprosy, but just about none of those have looked to see how enduring the effects were, how sustainable they were. So we're looking at that as well. And then the general model of involving people who already advise about the services, that general model that we advocate, we're also using in our work back here in the UK, where I lead an applied research center. And we always try, when possible, to recruit as our public advisors, people who are concerned with the service in some way, who have some experience of the service. And I'll come back at the end to the advantages of doing that. Thanks very much.
Thank you. Again, very, very, very strong areas there that you highlighted. Something that caught my attention was the element of economic empowerment, because arguably many times when you talk about power and sharing power, people default into the decisions about the research and how the public voice or community voice is involved in that. But actually, arguably, you could say researchers have the money, right? They're on a payroll. As part of the work and recognizing the element you've mentioned about in facilitating that economic empowerment, you actually give the communities you work with that economic power. They tend to be stronger by the time you leave out of your engagement with them than they were before you started the work.
Well, it is true that they do get economically empowered, but what I must tell you is this, that we don't pay for the economic empowerment parts of the interventions. We don't pay for that from the grant. We've been fortunate that we found collaborators who were already planning to make investments in those communities. So in Nepal, the intervention, the actual economic empowerment intervention, is funded by the Australian government. And likewise, in India, the actual interventions that we're evaluating are funded by the Leprosy Mission. And have previously been funded by CEI, the Swedish aid agency. So our role there is in the evaluation of the short-term and long-term effects of these investments.
Right.
And of course, the people with leprosy are in communities, rural communities, and we're also looking at the spillover effects from the leprosy investment onto other people as well.
Yeah, and the opportunity that all that brings in terms of galvanizing the resources and the networks that come within that context. So that's really powerful. Thank you so much. Jayashree, could I turn to you, please? And could you tell our listeners, how did you get involved in this project? What interested you? So if you can talk us your journey through and how you are actually, the role you're playing as well currently.
Yeah, thank you so much. So I was very pleasantly surprised when I got this email from Dr. Richard Lilford and team. And I jumped in right away because I have believed that there's the two different worlds that we are, one is the research and the team with the, technical expertise. And then there is the, people who have been affected and have some experience of the, the experience of the disease and have lived through it. And what I found wonderful about this is that there's a lot of inclusive participation with the team that is working on the project, which involves Dr. Lilford and team. And then there's Amar, myself, and a couple of other people who have the personal experience. And there's this sense of, respect, mutual respect for values and strategies, involvement in strategy. And there's a lot of action for authentic partnership. I think that is what is, extraordinary. That's what is required. And a lot of times it's like the research team might have understanding, maybe to some extent, a limited understanding of the experience of what happens to people, and the involvement that, happens through participation of people like, say, Amar and myself. That makes the whole project research more, forceful or, real. And that's what has been exciting. So I've been part of the, I've been involved in the grant development. My name has been added as part of that. And I've been, in the document I've been involved in the document writing of that. And then I'm part of the monthly management and finance committee meetings. I'm very involved in that. I try to pitch in wherever I can. And also in the overall executive steering committee and the scientific guidelines and advisory committee. And I also, because of the network that, I belong to, as a person affected, we have our own networks. One of them is called as the Global Leprosy Champions from all over the world, people affected by leprosy. So I've been able to help recruit more patient representatives to the team through my links. And I've also been involved in development and writing of self-care guidelines. And I wrote I'm very happy to be involved in writing a blog article for NIHR on my journey from leprosy patient to supporting communities and shaping research. Of course, I was very, very strongly supported by Magdalena. I want to thank her, and Swapna is always in the background. the teams from the same team, NIHR, and also contributed to article published in Leprosy Review Journal on the experience in receiving and practicing self-care as a person affected by leprosy. Although I'm not someone with any sort of handicap, but I interact on a very regular basis with people who needed self-care. And I've seen some amazing work in the community. And I think that became a very important input for us to take it forward with regards to how community involvement can help.
Thank you very much. Again, very, very, very rich information there that came out. And one of the things when you were speaking about I picked some elements that one could argue are the ingredients that necessitate power sharing. You know, when you're saying about the inclusive participation, having the mutual respect for values, having the appreciation of people's lived experience. So power sharing isn't that elusive thing. Actually, there are some, steps, if you like, that one needs to consider to make sure that it's done in a more meaningful way. So that is really strong. And I was attracted by, the level of activity or involvement at the strategic levels, the groups that you mentioned, from being a co-applicant to sitting in the advisory committee. To what extent do you feel your voice, is meaningfully integrated in those strategic groups that you sit? To what extent do you feel you have power to shape anything, to influence anything, discussions, decisions at that level?
So I would say I have more power than I might have used, because it's a very open forum, and Professor Lilford and the entire team is like completely engaging, people, like say, involving you and reaching out. And so I'm like completely on the ground, like, with the team. So I think the extent of involvement is like tremendous.
No, that's really great. And before we turn to Amar, I'm really interested to hear from you, because this is something that we've really struggled with, or some, researchers have struggled with, around really having a meaningful power sharing mechanism at that strategic level vis-a-vis a tick box. We have someone we are sharing power with on books, but actually in practice, it's not happening. So what tips would you give to someone involved at the level that you are on how they can be impactful, how they can have a sense of leverage, sense of influence or power, if you like, in
so I would say it's a two-way. It's the culture, the first that sets up, the environment, which the team here with, led by Professor Lilford is providing. So I think it all starts from there, because power cannot come from the community. It doesn't. It might be ideal, but it's not. That's not the way things go. And that's the reason when the empowerment starts happening at the community level, then they find their voice, right? So I think it's a very, I would say it's like a kind of a give and take, and it has to emanate not from the community, because the community comes much later, because they are not naturally empowered.
I think you've given a very good insight, and especially, it's one of those I call Twitter moments. One of the things you've mentioned is about creating a culture that is conducive to support power sharing, and this is what you say was quite strong. It's coming across that it's quite strong in this research, that the whole idea of having a grassroots approach, really, from the ground up, then it becomes really almost conducive, and it allows the community members to be able to have that voice, to share the power in that space. So thank you. Amar, I'm very curious to turn to you. How did you get involved in this project? What has your role been? And what have you found in terms of, our discussion topic today, in terms of power sharing and your experience within it?
Yes, first of all, thank you again, Saumu, for this wonderful opportunity. And like Jayashree, I also got an email from NIHR and from Dr. Richard, and I was so delighted. First, I went through the documents that he provided to me, and I studied all the documents, and I decided myself that it was a great opportunity for me to be part of this research. Immediately, I decided myself, and I promptly responded, and I'm so happy to be part of this research group. The main reason is, as a person affected by Hansen's disease, And I struggled a lot, and not only myself, many people who have experienced Hansen's disease, of course, they struggled in this way or that way. So as a lived experience, this is a wonderful opportunity for me to be part of this and contribute to the community, because our community members, truly, we want to reach to them. We want their real voices. We want the ground voices. So I think that, involving myself like Jayashree, so the real voice of people who have experienced Hansen's disease can be obtained. So in this way, I'm so delighted to be part of this group and to be part of this committee also.
Thank you so much. Now, you said something very strong here, which for me adds into my ingredient list around power sharing. When you're saying how you were approached in this project, you received an email and the documents for you to review. So there wasn't any element of coercion. And, the element, the element around having an informed choice from the outset, being given the documentation to review, and for you to just make that conscious decision whether you want to be involved in the project or not. That is powerful. And oftentimes it's missed. You come across some research where someone just sends them send someone an email or just word of mouth, and without sufficient detail of the work, and then people signed up, then later on they feel shortchanged and actually feeling, why did you give me half truths? So I think that is very powerful, the power of informed choice, the power of making available to you all the documentation about the research project. Then you decide as to whether you want to be involved or not. That is really powerful. So I think we had discussions earlier on, and you've been active in the project. Could you tell us a little bit more about the kind of work that you've been doing in this project? I think you're facilitating some meetings in Nepal.
Yeah, right. Yeah. Thank you again. I've been facilitating the meetings. In many meetings, I think more than 5-6 meetings that I attended, CEI meetings. And I got a wonderful opportunity to facilitate, to interpret, to translate as a translator. So what I found, our brothers and sisters who have experienced Hansen's disease or leprosy, they feel so comfortable to share their feelings with us, right? If they don't feel so much comfortable with others, but while we say that I myself is a person who has experienced leprosy, so if I start saying like that, they come so openly without any hesitation, and they bring the issues and the ground reality and the issues that they have been facing. So this is very important, that our involvement is very important. So I found, this is, very important.
Thank you. I'll come to you, Professor Lilford, so you can enlighten us how that community voice has shaped the decisions in the delivery of the research. But Amar, you said something quite strong as well in terms of the kind of work that you've been involved in, outreach, but translation. And it's very important because the element of power sharing starts with having a common understanding, and that common understanding often enough can get missed out if people are communicated in a different language. So not going there speaking English and assuming people will understand English necessarily, for example, or going there to speak a research language in as much as it's in Nepalese or it's in the local dialect, but in a research speak. So you are involved in the translation and making sure that people can actually understand, so you're on the same page. That is another of what I call ingredients to power sharing, making sure you are communicating at the same level so that you are not at cross purposes. Would you say, Amar?
Yeah, and also I want to add one thing, that IDEA Nepal exists in all 7 provinces. Nepal has 7 provinces, and IDEA has a very strong network in Nepal. So it has committees in all 7 provinces, so that whether in all the provinces, so where CEI meetings are conducted, so our strong involvement, our brothers and sisters, we already aware to them, and we invite them to join this meeting. So like Professor Richard earlier, he mentioned that it also enhanced their capacity also, right? It also enhanced their capacity, in terms of awareness and advocacy also.
Thank you, Amar. Professor Richard, I know you've mentioned this before, but just for if you can remind us again how the community voice that has come from all the enormous activity that Amar has been doing in Nepal, for example, has shaped the decisions in the delivery of your research?
So you will notice that behind Amar's head is a poster for the International Association for Integration, Dignity and Economic Advancement. And thanks to the voices of people like Amar and his colleagues, that is precisely what we're studying. The integration, development, and economic advancement. In our study, we'll be measuring those things, making formal quantitative measurements of all those constructs, the degree of integration, the degree of economic advancement, as well as the physical condition of people. And that has been the result of the power sharing, if you like, the collaboration, sharing of power, decision-making, influence, and responsibility between all of us, and learning from each other as we do so. So I've learned a huge amount from Amar, Jayashree, and all their colleagues about not just leprosy as a disease. I knew quite a lot about that already as a doctor, but about leprosy as a social and psychological phenomenon. And maybe they've learned just a little bit from my team about some of the design issues in research. So one of the manifestations of that has been the form of the research, which I've described, as you said, but we've also published a set of guidelines now for the management, this time specifically of people who are at risk of getting ulcers because they have a neuropathy they can't feel, and because they can't feel, they injure themselves and form ulcers, just as in diabetes. And we formed a set of guidelines for the care of those, which are being promulgated around the world now. They're being published in the main leprosy journal, and they'll be on display at various conferences that we go to, and are being disseminated through the leprosy missions around the world. And in November, I think it is, Sopna, we're all going to go to the Leprosy Congress, the big biannual Leprosy Congress in Hyderabad, where we will be disseminating some of our early findings, the guidelines, and preparing the ground for the results that are going to come out over the following year after that, so that dissemination, we've really pre-prepared for our dissemination, and a large part of that is through the networks of colleagues, so that not only will we strengthen the supply side of leprosy care, but also the demand side, represented by people who are affected by this disease.
Thank you, Professor Lilford, and that's really strong in terms of, you know, picking on my next point actually around the sustainability element of it. You've already talked about some of the results that, you know, are emerging or have emerged and will continue to, you know, to unfold because of exactly this, the idea, the concept of power sharing that you have in, you know, going on in your research project. But talking a bit more about the impact and you know, the long-term benefits, if you like, of this. So what is the anticipated impact of your research in other areas such as health service delivery and or policy decisions?
Well, I think our work is a great model for integrating people already involved in shaping services in the research, which evaluates those services. Our work on the treatment of leprosy ulcers, we've got a big clinical trial running there, which is running in the Andaman Hospital in Kathmandu, but it's treating patients from the whole country. That is a unique study, tests a method of a sort of artificial scab, a product made from the patient's own blood to promote their healing. If that comes out as a positive result, then it'll affect not just people affected by leprosy, but also people with diabetes, because it's the same kind of ulcer. And if it works in the one condition, it'll work in the other. Hasn't been tried properly in either condition before. So we'll have the answer to that. But above all is our work in the community. And we've got projects running, investigating community care in all 3 countries. We've got projects on sustainability in 4 projects. So we've got 2 of those in Nigeria. And they're looking at sustainability of previous attempts to improve the condition and lives for people with leprosy. And then, so all that information is being shared. The study designs have been shared. Our recruitment, our questionnaires have all been shaped by public involvement. And we look forward very much to disseminating those in due course, through networks of people that we've engaged so far. And of course, well, I should make this further point, of course, that in research, we get a grant and we do research. This is a 4-year grant. We hope it'll be a 4.5-year grant. But then the funding from the agency, from NIHR, will come to an end. And obviously we'll try and maintain our relationships. But it's difficult because we won't have the funding anymore. We'll try to get follow-on grants, but they can't be guaranteed. But one thing that can be guaranteed is that the people we work with, they're going to continue to be associated with leprosy missions and the hospitals and clinics that they've been working with. That'll continue in perpetuity until the last person with leprosy in the world has finally been treated. So that's a way of making our legacy more enduring.
And that in itself is really powerful in terms of that long-term impact of that you leave in the community, to use your own word, the legacy that the project leaves. And quite interesting to hear Jayashree and Amar's view on this, but some of the feedback we get from colleagues like you getting involved in these spaces is that they feel empowered to actually negotiate power spaces in other projects beyond, in other spheres, beyond the research that they're involved in. So for example, in policy decisions, in getting very active within the civil society sector. Do you find you have a similar experience? Is there anything that you've got by, for yourself as part of this, maybe your confidence enhanced, that you feel you can go into spaces that probably previously you wouldn't?
Yeah, absolutely. I think it was very important to be involved in this project, and the way the process of the project, the involvement of, Amar and myself and the rest of us who participated. So how I say it is that, it's like authentic community and academic partnership, right? And it leads to, increased accountability and also equality between us, the two sides. And I think that creates a lot of possibility for us to, I'm sure I'm talking from us who have been involved, that we take this to our lives and to the other communities and groups that we're involved in, and make ourselves available for such interactive participation. So that's something like, I think it's like achieving better and more acceptable decisions because people from the community have been involved in the process. So that is a takeaway from this entire experience. It definitely has made me a more involved person.
Thank you, Jayashree. How about you, Amar?
Many parts Jayashree covered, but what I want to add is, since many years, I have been advocating for meaningful and impactful participation of people who have experienced leprosy in all levels. Not only that, we need 2 leprosy people who have experienced leprosy, right, for this committee. Okay, now, so we have 2, the finish, not like that, meaningful and impactful participation. So that sense we have got in this project, that sense we have got in this research. And so we are so happy that, as Jayashree, many times she mentioned that our voices are strongly heard. And we have sensed that. And so this is very good. And we really appreciate that.
Quite encouraging, the true testament of leaving no one behind in this work. So, what I've heard so far, and listeners, you probably will agree with me, is that there's been really glorious events that have unfolded around CEI in this project. I wonder though, Professor Lilford, what, if anything, would you have done differently in terms of CEI in your research award?
I'm sure I haven't been perfect, but I can't particularly think of anything right away. I think that the involvement of all our public representatives in our guidelines has been worked through very successfully, and the guidelines have had a lot of publicity and been published. I think that question really is for Jayashree and Amar to answer. Is there anything I can do better? We'll certainly like to do that.
You made my task tough, Dr. Lilford, because I find nothing that we could have done different. I think we are, raring to go, and we're doing wonderfully well. I find it every step. There's so much of collaborative communication, partnership, and I must place on record, the team that's behind, there's an extreme level of transparent communication. So I want to put on record, like Swapna, Magdalena, and the rest of the team have been very cooperatively interactive and transparent in their communication. So I think we are good.
Thank you. And Amar, do you have any reflections around things that could be improved?
No, I also agree with the team, with Jayashree, that that so many good things are happening. So I entirely agree, and so many support that we get from Swapna, Magdalena. So I think that we are heading towards the right direction. I can say this much. Yeah.
Thank you. So what I'm hearing from all of you really is that actually when you get the concept right from the outset in terms of power sharing, you almost open a structure for yourself where you are able to embed continuous improvements, because you are getting these views and suggestions for change as you get along. So really there isn't anything that magnific, like massively different you would have done, because we are incorporating the changes as you go along, because the power is shared. You are able to get that input and that feedback almost like a continuous loop. Now, I really going on to my final question, really, because I'm keen to tap into your wisdom here. You definitely have something, you've got it right. It's doing really well for you. But I'm conscious that there are other researchers out there where they're either at the beginning of the journey or they're quite apprehensive around, letting go of some power spaces with some community members. If you are giving advice to someone looking to embed CEI in their research, what 3 tips would you give them?
I can give 1 tip: collaborative power sharing.
Collaborative power sharing. Yeah. Listeners, I hope you're treating that. Yes. Any other tip?
I'm involved in a lot of grant applications and giving people advice on their grant applications and reading grant applications. And I think the research community, here in the UK, really does tune in to public and patient involvement. It's been quite a strong theme in the NIHR since its inception, and it's got stronger and stronger over that period of time. I think perhaps some people, when in the early days, were sort of reluctant participants because they just knew they had to do it in order to get that grant. But I think as people have become more and more familiar with public engagement, so they've actually assimilated the ideas of engagement, realized how valuable it is for all the reasons that we've discussed at every stage of the research. To some extent, and I found this in my applied research here in the UK, to some extent, the researchers are leading many other organizations in the extent to which they are committed to the notion of power sharing in their research. Where I find that although we involve lots of, we always try is to involve people who are shaping the services in our research, some of those services don't have as much engagement as they should. And so this may be one area where we're ahead of the curve and where we can be on the vanguard and inspire other parts of the health and social care system to copy what we've done in research.
Thank you so much. So I'll take that as an invitation, dear listeners. If any of you want to know how to embed CEI in research, Professor Lilford has just offered that he's happy to have a conversation with you to take you through how he's done it. And I suppose the tip I'm getting from here is just do it. You'll be happy that you did.
And may I just say that, it's not just me, it's a whole team that I've got working on my applied research center here, my previous work I did on leprosy, the work we're currently doing on work in slums and informal settlements, the work we're planning to do in cancer. In all of these things, it's my whole team that has helped. Because it's quite a big organizational task in creating situations, forums where power sharing can really take place. And I must thank my team, and in this particular context, particularly Swapna here with me, and also our colleague, as we mentioned a few times, Magdalena Skybrand, who leads across all my research themes on public engagement. I'd like to thank them for their strong support.
True testament, I think, to the commitment of power sharing, to a point of, even in terms of the accolades and the achievements, you could hear from Professor Lilford here saying, it's not just me, don't just recognize me, recognize everyone, because you know, I am just a spokesperson of everyone else, but we are here as a team. So thank you so much for that. Well, thank you so much, Professor Lilford, Jayashree, and Amar, for what has really been a great discussion. And a huge thank you to all our listeners. Please do share, tweet, and tune in to other podcasts in the series. And please do let us know what you think by sending an email to social.media@nihr.ac.uk. That's social.media@nihr.ac.uk. That's all from us. Enjoy the rest of your day.